We have an important conversation today. It's one about your mental health, and it's something that we probably don't talk about enough. We should be talking about every single day. Your mental health during infertility, your mental health during a year that also we are dealing with a pandemic. So we have an incredible guest that's joining us, Alison Chrun, who is an LMFT from the Center for Fertility Support. So what I love about today's guest is that her expertise is specific to what we are going through, which is this infertility journey or the struggle to conceive, secondary infertility or PCOS or endo. She's going to be joining us in just a moment. And this is an Ask Us Anything, just like we've been doing consistently. I just want to say hi to a couple folks. Hi, let's see. We've got Frenchie Jen joining, Allison, Purple Genius, good. I feel like some of you are my regulars. It's so good to see you, Chelsea and Veronica, Ariana, Melanie, Becky, great, Lala. Oh, cute, Lala. There we go. So she is joining. And this is something that let's see. That was not her. Okay, I'm going to try to add her myself. Let's see. Let me look, you guys. Hang on just one sec while I get Allison on here.
Lauren, Purple Genius. I'm good. Okay, there she is. Oh, yay. I get so excited when it works. How are you?
Good. Hanging in there. How are you?
Same. I feel a little frazzled today. I threw my hair up. It's today Thursday. Is that the day of the week?
It is, yeah.
So I feel like on Tuesday this week I went, is it really only Tuesday?
I know.
Yeah.
I'm going the same. Thanksgiving is next week.
I can't even believe that. And I know that everybody's holiday season seems to be disrupted. The thing that our community, of course, is dealing with on top of everything else that there is to deal with is we're collectively dealing with a lot of pregnancy loss. Mm-hmm. We're dealing with sort of struggle after struggle after struggle. I mean, we have so many members of our infertility / trying to conceive community that are they're trying to find answers. They are dealing with appointments in a totally different way, right? And every passing delay, especially when the clinics got shut down earlier this year, I think has made the mental weight and the emotional struggle all that much harder.
Yeah, there's been a definite increase in me seeing clients for not just fertility-related issues, but the pandemic thrown on top of, that stress. And so that's just been so impactful for so many.
Yeah, it does seem like I think I want to, even back up a quick second and talk about your practice. First, what was your calling into this field, especially focusing on fertility? Because that is so unique, and it's wonderful, I think, for our audience to know that there are therapists and specialists for fertility.
Yeah, and it's a very small niche, but it's also something that is so prevalent. So that's an interesting kind of dynamic. For me, it's not really work for me. Therapy just doesn't feel like work. It's a very natural kind of thing that I offer. So I've always been the therapist in my friend group, the therapist in my family, somebody who processes emotions and just finds a lot of comfort in, emotions in general and understanding that and really connecting to people. So,
that's amazing. I feel like every family needs to have at least one therapist in the family, one attorney, one doctor or nurse, right?
like those networking meetings you go to. You just need to have one of everybody. But, exactly. Fertility it fell into my lap, really, and I am a mom of 2. And so being a mother has been so incredible and important in my life, and being able to really share in that with others who are actually going through the fertility process has been kind of a whole other side of therapy I never thought I would visit, but I love it. Yeah.
That's really beautiful. So, infertility certainly is stressful, and studies have found that infertility patients feel the same stress as even people who have been diagnosed with cancer, and I've gone through both. I was diagnosed with cancer, and I did find that the idea that the cancer treatment would leave me infertile was more traumatizing than the cancer itself. Because we were kind of raised to believe, like, we caught it early, you're going to be fine, you have to go through all this awful treatment. But the idea that something could strip me of my biological sort of right, my biological processes, my womanhood, I already had to remove my breast, now you're telling me my womb or my ovaries aren't going to work. What is it about that idea that like our female reproductive system is failing us that does cause so much stress during an infertility diagnosis or during kind of an infertility journey?
Well, in general, anything that's out of our control is stressful. So if you think of it that way, it makes a ton of sense. Anything in your daily life, just as a whole in life, right? So our health, when things are in our control, we can change our diet, or we can just take this medicine or take this vitamin. Things feel a little bit more regulated. But when we don't have control over a disease, an illness, fertility, these are all things that I want this so bad. Why can't I just have it? Or I want to be cured so bad. Why? I don't understand. So not having control creates a lot of stress and anxiety. But put on top of that with infertility, the financial aspect of it. I mean, we don't know if this is going to work. There's no guarantee for what, we're pouring all of our finances into, if that's going to work. And that can cause strife. Right. And relationships can be complicated thereafter. So it's compounded stress of all these things that we can't control.
I like that word a lot, compounded. Mm-hmm. And because I feel like that is the cumulative impact of this year, right? Like if it was only the pandemic, if it was only infertility, or if it was only the physical part of infertility and not the financial part, I that's the word for me. And someone just asked, Ariana, you asked a great question. How does then the anxiety affect fertility outcomes, and what can we do to help manage it? I mean, that's like so solutions oriented, and let's jump right into that. Yeah. There's a lot to talk about in this one conversation, but let's jump right into that, because that's part of the compounding impact, right? That you have stress on top of stress on top of stress, and then that anxiety then, or the impact of that stress, the high cortisol levels, actually has a physiological impact on you.
Exactly. So stress is it's almost like a roadblock. And if I can't get through it or over it, then it's like I can't get to kind of like my next destination of sorts, or it makes it harder, right? So if I'm constantly jumping hurdles, and this is like maybe stress is a great representation of that, it can make our bodies physically react. Our mind has so much power. I mean, it can affect our entire body, and stress is probably the main impact of, doesn't mean that it's going to keep you infertile. It's another roadblock. And so managing that anxiety is exactly what you want to try to do. So, of course, I'm going to say go speak to a therapist. If you're individually, and maybe even as a couple if you're in a relationship, speak to somebody, because this is so taboo. And so we don't talk about our struggles. We don't talk about what's hard, because a lot of people, if they're not sharing, I kind of feel isolated and alone. So right. I can talk about those things and get it out. That's a release of stress in a sense. And then on top of that, self-care. So things that bring you joy is a huge thing, whether that be meditating to bring you calm. And I know we talk about serenity, but to bring you that serenity, decrease the stress, maybe yoga, exercising. If you love cooking, taking baths, finding joy every day, but also maybe taking a break from the fertility process if you need to. Stepping back and saying, time out, I need a break. I need to maybe live a little bit, because my mental health at the end of the day is the most important thing.
Alison, I love cooking, but I've kind of taken a bit of a break this year from cooking.
Yeah.
So it's been weird for me, because I normally love to cook. I love to nourish my body and my son's body, and I did get to have my 7-year-old only because I did fertility preservation and I had frozen embryos. That's the only reason I am a mom. Mm-hmm. And I've been kind of like looking at that and going like, this is so weird, and I've been a bit judgy about it. Like this year of all years, I should be cooking. I should be nourishing us with homemade food. I just haven't had it in me. I haven't had the energy, and I've been supporting my local delivery people.
Yeah.
all year. Yeah. I'm feeling good about that part.
Yeah. And, I think a part of it is also the things that we've been doing that bring us joy. They're also offset by the things we get to do every day. So when we take away one thing, we might overcompensate on another. And so cooking might bring you a lot of joy because maybe you're going to the office every day and you're doing this and, you're going to school and, if this is a part of your routine.
Right.
But now cooking might feel like a chore, and maybe I've been in the kitchen all day and I don't feel like I want to be here. And it's kind of the same concept. It's just, and it's okay. If something's not bringing you as much joy anymore, you can refocus and you can always go back to that.
I love that. I also feel like I just need to hire somebody to clean up for me, because so much of it is about like the endless chores when you're working from home, living from home, doing everything from home. And like you said, you know, like if I cleaned up the house the night before and then I'm out the door, maybe I hire somebody to be with my son, it's their job to like pick up. So I come home from work and I'm like, yay, everything's clean. So then I don't mind having to clean up after, you know, cooking or something. So I think that makes a ton of sense. Oh, hi, Andy Garcia from Mexico. Of course, you have such a famous name. Hi, BB. Hi, I am Nancy Joe. Jay Brucey. Let's say hi to some other folks. Parthiban. Oh, beautiful. Hi, Donor Concierge. Oh, my goodness. Hi. Emily James. Will D. Flores. Hi, everybody. Waving to everybody that I can. I'm so happy to see you all. And remember, you can ask us anything. Ask Alison anything. Integrative Fertility MD is here. We love integrative health practices, integrative fertility. We love them so much. We talk a lot about them, and I want to have you on the show. Andrea, hi. Charlie, Claire, hi. Love seeing you all. There's some other questions that we have already planned, but please get your questions ready for Alison. She's here to support you. Let's talk about hormones. So they can certainly be the bane of one's existence. I've even noticed with me, I'm now 44 and I've already, dealt with infertility. I've had chemo, I've been in medical menopause before. And so I know that I'm probably heading into earlier menopause than I would have, normally. And I've noticed that even my PMS is harder, but my cycles are shorter. My PMS is longer. My cycles are shorter. So I do want to understand, the hormonal fluctuations with like going through IVF, because we're using synthetic hormones. What can we expect the impact to be on our mental health so that we can normalize that too? Because I think that the hardest thing is when something's happening and we're going, is this normal? Am I feeling normal? I feel out of my body, or I don't feel right, or I feel more anxiety or more sadness, or I'm crying at the drop of a hat. How are those hormones impacting us mentally?
That's a really great question. And, normalizing all of this and just mental health in general is so important. Like, we all experience mental health issues, if you will. We're just on a spectrum. And honestly, it's all throughout our life. We're up and down, we're back and forth, depending on every circumstance of our life. And so take infertility. I mean, it's incredibly stressful. I'm stressed out. I'm trying not to have expectations. There's already so much going on in my head. I'm hopeful, but I don't want to be too hopeful. And so pumping hormones, like you said, synthetic hormones into my body is going to impact me. We don't know how it's going to impact me, but it is.
It's supposed to impact me.
Yes, and we don't know how severe. So we will be on a spectrum. Knowing we're going to be on a spectrum is I think it's the most wise thing to do when you're going into this, educating yourself and saying, okay, so I am going to be on a spectrum, but I just don't know where I'm going to be. And it can fluctuate from, irritability. It can be, anger. It can be sadness. But I think where I step in and say, well, all of this is very normal and hopefully temporary, right? When it starts impacting your daily life for a period of time, that's when we need to start being concerned. So fertility treatments is one thing. Then you could have pregnancy hormones you experience completely different than the synthetic hormones you put in your body.
Right.
And postpartum could be completely opposite.
Totally different. Yeah.
I
was so worried about postpartum depression, and because I dealt with anxiety and depression, especially during pregnancy. And then that first year after pregnancy was like the most stable, happiest time of my life. I didn't get to breastfeed because I had a double mastectomy. I made homemade formula, but like that first year in particular, even with the lack of sleep and all the other things, was bliss.
Oh, yeah. And, same for me. Like with my first, I think I had more of the baby blues afterwards. And so I was pretty scared with my second. I felt euphoric after my second.
Oh, I felt euphoric. Yeah.
It's so different. So it's like, and I have clients who come in who are pregnant and experiencing depression during, pregnancy and are terrified of postpartum. And then they come in after and say, I feel amazing.
Yeah. How do I hang on to this? I was like scared, right? Because I was like, how do I hang on to this?
Yeah. I just think that it's important to understand that there will be an impact. We don't know where we're going to be on that, but everything that we experience is normal because it's so unpredictable.
I see. I think that that's great. This is normal. I'm normal. What I'm feeling and going through is normal. Alison is asking a really important question that I think pertains to Justin, not you, Alison, a different Alison on here. Pertains to pretty much all of us, I feel like. She's in her 2-week wait, which is one of the most anxiety-inducing weeks of our lives, especially because we've done all the work. We've done all the prep. We've done all the hormones. And hi, sweetheart. I was just talking about you in about 20 minutes. And her FET was just, that was too loud. I know. Her FET was on Monday. And so she's feeling all the feelings, especially because her first one ended in miscarriage. Hey, you gotta be quiet. I know. Most people are used to hearing Dante interrupt from time to time, which is fine. But this is the hardest thing. So, Alison, first I want to just say, like, so many of us have had repeat miscarriages, and she just had an FET in September that ended in a pregnancy loss. So coming off of something that was traumatizing, and here she is, totally courageous, rebounded to do it again, in November. And, what's the best techniques or what should she be doing to manage her anxiety during this 2-week wait? And of course the holidays, right? Especially coming off of trauma. So much of this process is traumatic.
Yeah. I think, if I were to come from just kind of, anxiety in general, like I said, it's that letting go of control, knowing you've done everything. It's kind of like setting the mind into a state where you understand I've done everything I can do, and what is going to happen is going to happen. And so almost like a letting go of what's to come and living in the moment. So when we can live in a moment and just deal with things day to day, how can I best take care of myself today to get through until tomorrow? Because tomorrow may come with a whole other set of concerns and worries and things like that.
Right.
Just really nurturing myself and being gentle with myself because it's out of my hands now. And I don't have to do the work right now. Right now I need to wait, be gentle, take care of myself, relax, try to stay calm, which means, the meditation or the listening of the music and just whatever makes you feel calm and good. Also, boundaries. So keeping any negativity away from you if you can. Right now we're in the holidays, family members all over the place. Everyone wants to plan something or know what you want for Christmas or things like that. And it's like, I'm going to set my bubble, and there's only going to be a few people that are kind of allowed in and out of my bubble right now, and just let everybody know that I'm kind of taking care of myself, and I'm not going to allow any negativity into my space.
Boundaries, that's a really, 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 I think, important part of this infertility journey. We as a community talk a lot about the stupid things that people say to us. Might be well-intentioned, but it still comes out, and it's like, you got to be kidding me. That's the best you got. We talk about how much we hate the word just in front of anything. Just relax, just stay positive. And you talked about the spectrum. We did a whole episode with Dr. Raquel, who's our naturopathic fertility specialist, about the idea of, like, you can't stay in any one state. That's not even remotely possible for the human existence. And it seems that when we have a good day, we're like, I want to feel like this all the time, right? And then when we have a bad day, we're like, I must be depressed. And it's just a feeling, right? It's just an emotion, and we can just like be with it and let it wash over. But that word boundary, I struggle with it. I think I struggle with it in the sense of how do you set a boundary in a way that doesn't piss somebody off, doesn't hurt their feelings? Sometimes I feel like when you're first practicing boundaries, it might come out a little harsh or aggressive. Mm-hmm. So what's a good example, or can we brainstorm for everybody, like how to set some healthy boundaries in a way that acknowledges your own love for yourself? And maybe it's so empowering for the other person that they're like, that was a really great way to set a boundary. I'm going to use that when I need to set a boundary. Right.
Well, so I very much believe in transparency. And that doesn't mean oversharing or letting somebody in that shouldn't, be in your life. But I'm very transparent. So when I need to set a boundary, that could be taken the wrong way, possibly, especially who I'm dealing with. What I do like to do is validate, because ultimately we are human beings, and when we have relationships with people, we do like to be validated. And so validating right out of the gate, saying, I realize your intentions. They're amazing. You've always been here for me. You've always been a great friend, and I appreciate you so much. And right now, I'm really just focusing on me, and I need to express to you that I'm kind of going through a hard time. And so what I need from you is just a little bit of respecting of my space, or whatever our intention is, right? If that means that I don't want somebody to ask me maybe for a favor that I usually do for them, you can say, I'm not sure I'm going to be able to show up for you the way I've been lately, because I'm going through my own stuff. And I know that you understand that. I know that you respect that. And that's just what I'm asking of everyone right now. And just really validating, but also being transparent with, things are a bit tough, and I need you to support me. This is my time where I'm going to ask you to support me.
I love that. I feel like you can never practice boundary setting enough, right?
Oh, never. I mean, I was the same. I had a really, really rough time because I hated confrontation until I realized, confrontation doesn't have to be bad.
Yes, exactly. I kind of had that relationship with anger, where I grew up thinking anger is bad, anger is wrong. And so I didn't necessarily learn until I was well into my 30s a healthy way to say those words out loud, really until I was probably raising my son and teaching him to say, you don't have to hit, own your words, right? And say, I am angry, and here's why. And like, there's so much power in that, but I really did struggle with that. Has anybody else struggled with that too? Or do you struggle with boundary setting or, expression of your emotions when you're in the moment? We have somebody joining from Brunei. I don't even know where that is. I'm embarrassed. I need to brush up my geography. It's 8:27 where she is. She joined late. Yes, we're saving this live. We always save all of our lives to IGTV. This will be listed under our special guest interviews. Lauren she's gearing up for another FET. She had one that resulted in a miscarriage too. And, it's the idea of, I don't want to set myself up for failure. And I loved what you said. It sounded like such positive self-talk. I've done all I can do, and that's all I can do. Mm-hmm. And kind of being okay with that. And I've noticed that about myself too with this pandemic. It's been harder to do the positive self-talk. There's just so much of the fear-based self-talk during this year. And I think, with Lauren as well, I don't want to set myself up for failure. It occurs like fear-based talk. How could we help her replace that with maybe positive self-talk?
So we do have, our rational and irrational thoughts, which I'm sure a lot of people understand about themselves because that comes with anxiety. But something that you can do is think about what could happen. What are some of the amazing things that actually could happen? Because the fear just sucks the positivity out of you. It sucks the optimism out of you. You just start that fear is just, it engulfs you. It's a blanket. It's hard to get off of you because maybe you've been disappointed so many times. We don't want to get our hopes up. But to understand that this could go really right. This could go exactly how I want it to go. What would that feel like? What energy would that feel like? And to kind of live in that for a minute, experience that energy, because when we experience those things, we really release it out into, our own future and our own path. And it doesn't mean things are going to work out the way we want them, but trusting that things can work out. It's possible.
And that you can handle whatever the outcome is.
Absolutely. Because I'm strong and I've done this. Yes.
Yeah, I love that. And Lauren, we know because you've shared so much of your story how strong you are. And I love that of like, I am strong enough to handle whatever happens. And, that positivity that you're speaking into existence. Mm-hmm. There were some studies they did on Olympic athletes, right? And even like under stress tests when they were visualizing success and visualizing positive outcomes and the difference it made on their physiological state. And so, I think that when we look to actual evidence of how important it is, but again, not to beat yourself up when when your negative thoughts are there, it's like an opportunity, right?
Mm-hmm.
So I've got that dark thought, like, wow, I'm really scared. You know, my sister has COVID right now, and I've been, definitely afraid. When I feel fear, I go right into action, and that's how I deal with fear, is like I take action, but replacing that with telling her, you are strong enough. Your body knows exactly how it's supposed to perform right now. Your immune system is well developed. It knows how to help you heal, and then just maybe reminding her of like the gentle, loving things that she can do, whether it's an Epsom salt bath and lots of rest. And please don't try to do remote work right now, sis. Just be gentle on yourself. Bone broth. And I think it's so much the same, right, when we're dealing with a pregnancy loss and dealing with like infertility. Like, your body is strong, your body is resilient, and whatever the outcome is, like, we know that you're going to be okay.
Right. And I think a great tool, if we were to be looking for tools too, is to journal and to really express those fears in a way that is honest and real and raw. If you need to put it down on paper because you need to get it out of here. And when you put that on paper, you can go back to it anytime you want, but you also can feel lighter and say, so I put all that fear on paper, and I'm going to go be lighter because I put it out there. And if I need to revisit it because I'm starting to feel fearful, I can go back to it and revisit it, because that's okay, because we're human. Sometimes we need to understand why we're feeling some type of way, or even see how far we've come. So you can always go back and go, man, yeah, I've come a long way, or I really don't need to fear this anymore.
Mm-hmm. I love that. And thank you from Southeast Asia. She's laughing at me because I didn't know my geography. It's actually Southeast Asia, the island of Borneo. Oh my gosh. Well, thank you for tuning in. We're so happy to have you. Shelly also, unfortunately, she's been doing IVF for a few months and had a miscarriage just this past weekend. And it's been really hard. And she brought up something that's a really good point. She wants to stay in a good mindset, but also grieve. And she brought up like grieving in moderation, where we try to give everyone in our community permission to grieve, and encourage space for grieving and space for the processing. But I think that a lot of us are worried about like drowning in our grief.
Mm-hmm.
Where is that balance? And like, how do you even, I remember somebody saying this to me once. She was like, I feel like I've cried all the tears, but I keep crying. When am I going to stop crying?
Yeah. And, grief really is very, very personal. Like, we need to understand that everybody's process is so drastically different. It's not just one step and the next step and the next step. It's messy, and it's all over the place, and it's okay. And I think that's the most important thing to understand, is that it's the most personal thing to you. And so to grieve is to really understand yourself. And it's really, really important that we do grieve, because it doesn't make it bad. Avoiding grief, that will kind of prolong the process. Right? Maybe that'll make it a bit harder. So we need to be very open to really acknowledging. And I think that's one of the biggest, that's a really big word that I want to say. Acknowledge yourself. Acknowledge all of those feelings and emotions. And also, if it works for you to say, I'm going to give myself today to grieve. It's kind of an open-ended, it's long enough, but there's a cutoff time. And I'm going to give myself today to grieve. I'm going to lay on the couch. I'm going to cry. It's going to hurt, but tomorrow's a new day. And if you wake up the next day and you feel like, I did a lot of work yesterday, today I deserve to be happy and to feel joy. And if that works for you, it's kind of like you have to do what works for you, because it's so personal. And rather than, we don't want to drown in it, that's when I always say, if it starts affecting you in a way that you're not able to climb out of that, or swim through it, that's when you start asking for help.
Yeah, that's a really good point. I do want to acknowledge that the first time I had a miscarriage, I was depressed for a month. Mm-hmm. It was a whole month, and I felt like I was never going to feel joy again.
Right.
And it was, on the couch a month, and there was a turning point. I had the idea to write a letter because I kind of felt like and maybe it was I was writing to Dante because I knew that I knew I had a child that was going to be mine at some point. I still held on to that belief, and I just thought, okay, it might look different. I might have to use the embryos, or I might have to adopt, or, you know, I was open to all the different pathways. But I do remember writing a letter and then burying it. Mm-hmm. And I remember also writing a letter to myself. And that was kind of a turning point. This is many, many years ago now. This is almost like 11 years ago or 10 years ago when this happened. But I was one of those people that, like, for a whole month, it was really, really difficult. Shelly, our friend from Southeast Asia, was saying fear sucks the optimism out of her. Mm-hmm. You know, when you're feeling afraid and you might have a rush of cortisol, right? Or you might be in fight or flight mode. You know, what are some kind of similar techniques that she could use to cope with the fear and to move, you know, from fear back into the place of optimism? Is it like saying things out loud? Is it keeping them in your head? Is it putting the fear down on paper and crumbling it up or burning it? You know, what are some good techniques for that?
Yeah, I think that the tools are just so important because they put you into action. And so, you know, it's hard to, sometimes we crawl in bed and we cry. It feels a bit, we're suffocating. And so to really get out and put things into action is so important. And I don't even like to say when you're ready, because it's like, when will I ever be ready? You know? And so allowing yourself time to internalize a bit so that you can release is important. But I love that you said you wrote a letter, because sometimes we need to write a letter to ourselves, and sometimes we need to write a letter to the baby I just lost. Yeah. And sometimes I need to tell that child what it meant to me and what this loss has meant to me, because sometimes we feel like because they're not here, like they're not being acknowledged, and that hurts even more because you existed to me, and it feels so painful. And if it's, whether it's a letter to yourself or to a relative or to anybody, that is so cathartic, and that's such a great tool. Writing your fears down and burning them has always been something that is a great action to do. It's very, very representative of, like, you know, releasing and letting go, and welcoming maybe something more positive. Yeah, I mean, there's just so many different ways to do it, and I think that it really is personal to everyone.
Yeah, it's hard because when you're depressed, you feel unmotivated to do anything, right? But sometimes just that teensy tiny action is like the thing that unlocks you just enough to then do another action. Yeah. And I find,
or even like an accountability partner, somebody to only allow you to maybe distance or isolate for so long. I need you, and doing an action plan is so crucial. So, like, if I know I'm going back into another cycle, and I need my support group, I always talk about build that support group prior. So you can say, you're my accountability partner. This is going to be hard for me. So if I start doing A, B, and C, or you need to wait this long before I reach out to you, I need you to reach out to me and do A, B, and C. Having an action plan is so important.
I think that's great. That's great. Having like scenario planning before you even gear up for it. And Shelly Davison is asking, she was 9 weeks along. Should she be sad? Is it normal? She's going to try another transfer next year. It's just all so hard.
Yeah. So she asked, should she be sad? Yeah. I mean, I think that if your grief is so personal, and I think we visualize what our lives are going to be like. I mean, when you're that far along, you can't help but to visualize what my life is going to be like, right? And so I absolutely think grief is necessary. It's so necessary. I think depression is necessary. I do. I think that we are on a spectrum, and when it starts to really swallow us, that's when we reach out for help. But it is necessary to transcend us to the next level of healing.
Yeah, it feels like we just have, you know, like the human experience is just filled with endless trauma. And the more tools that you acquire while you're healing from one trauma, the more equipped you are to deal with the next one. Or maybe the time frame of depression and sadness is shorter. You know, Frenchie Jen is asking a great question. How do you balance bringing people into your journey so that you don't feel alone through the good and bad, but also knowing you shouldn't overshare because others may not be in the same place in life?
That's such a great question. And that is one that, even working with like intended parents, that is like the biggest, like, I'm afraid to share because I don't know what's going to come of this. And so I think depending on who you are and how you feel about sharing and what you really have shared in your past and experienced, it's important to have a bubble that feels good, but that you don't feel obligated to those people, right? You don't feel a responsibility to those people. And so am I going to disappoint them? That can't really be the logic. It has to be about you, your well-being, your mental health. And if they are an addition and they agree and you feel that they can support you and be an addition rather than take anything from you, that's kind of where you gauge that. It is a balance. And so I say, do it cautiously, but also don't be closed off to asking for help and support and sharing those things.
I love that, especially the word responsibility. I feel like we all need to be reminded that we're not responsible for our friends' emotions. We're not responsible for our partner's emotions. We're not responsible for our doctor's feelings.
Right.
And I personally think, like, as women, we tend to take it on being responsible. Like, I want to make them feel better rather than, no, I'm only responsible for myself. And so I love that you brought up that whole idea of, like, what are you really responsible for? And you're just responsible for your own wellness.
Yeah,
and you can be kind to other people. And, being kind doesn't mean that you have to make them feel better, So I love that too. I think that was, like, just amazing. Alison is just saying, like, grief counseling did so much for her. She said it was so helpful. Literally, like, an exclamation point. I agree.
Yes, I do too.
So important. As 1985 also said, she's had some miscarriages as well, and just acknowledging that she fell into a deep depression for sure with her first. She was already suffering with anxiety, as was I, because it was in this post-cancer sort of recovery year where I didn't even think I could get pregnant, so it was very unexpected. And so then it was like this big hope of, like, wow, my body works? And I was, like, shocked and then terrified and then totally, just, oh, of course my body doesn't work, and just, horribly disappointed and depressed. Like, my life is never going to be, quote unquote, normal. I'm always going to be the cancer recovering girl or, this or that. And, and it was, 13 years ago. And certainly the cancer was 13 years ago and still dealing with anxiety, especially now being a mom of a 7-year-old, is it going to come back? Can I safely have number two? And for App, it's the same thing. Like, her anxiety is still there, and she's just thanking us for the discussion. And, when you live with anxiety on a regular basis, like I do and like App does, and probably so many people this year in particular, right? I sometimes want, like, a rule book. How am I supposed to do every day? I mean, I'll tell you, like, anxiety makes me feel really tired. I get pretty decent quality sleep because I take the melatonin, but I'm still drinking coffee, which is not good for my anxiety. But I almost feel like I need a rule book of, like, how am I supposed to, go about my day to try to, like, not have the anxiety kind of overtake me. I mean, chronic anxiety. What are your tips, tricks, advice, for kind of that?
Well, for me, with anxiety, less is more. So overwhelm is already a given. So I'm going to be overwhelmed by pretty much everything if I have chronic anxiety. Less is more.
Mail. If I have, like, a stack of mail, I'm like, forget it.
Yeah.
I'm going to get open for a month.
Because it's that lack of control. It's that I don't have control over even how I'm feeling. So what can I control? That's messy. I don't like that. So I need to clean that. Or, I need to organize this and make sure this is in line because that's what I can control. Right. But going back to basics and realizing that I really just need to be a little bit more selfish and take care of myself. And if that means I really want my space to be clutter-free, or I really want, things to be more organized, that's okay, but we're not going to take it to a place that actually overwhelms me so much, right? Because I need a space to be clear and to also declutter my brain. And so less is more, realizing that it's okay that I can't control everything, and I think that's the hardest concept. And so I just love meditation, and I think that meditation is vital to recentering yourself and realizing that all you need is you.
Yeah.
And so that's been really helpful for many, many clients of mine who never thought meditation would help.
Right. I'm one of those people who I didn't think I could do it.
Right.
And then I got into it, and it's like, it's daily meditation plus a Peloton ride just for 20 minutes. And I hate getting on the bike, and like every day I get on and I'm like, oh, I don't even think I can get my legs to do this. And yet, 20 minutes of sweat later and I'm like, I feel great.
And it's just doing those things for yourself. Even, it's like what I said, like, even though you don't want to get out of bed, but you get in that shower, you feel so much better after the shower.
Like fun.
I
did organize a kitchen cabinet that was driving me bananas, and I went ahead and ordered like all the clear plastic bins. So like every type of pasta is now in a clear, plastic bin. And
right.
You guys are going to think that I'm either crazy or hysterical. I kid you not, yesterday I opened up the cabinet and I was like, oh.
The angels were singing.
Cabinet. Yes. I love my cabinet. Because I can see everything. And that was kind of a tip that I got from being obsessed with the home edit.
Yes, I love that show.
I love that show. Gosh, I need season 2 to come out so bad because it has made a huge difference for me where it's like, okay, I'm not crazy for wanting everything to be disorganized. It just feels so good. And if you are somebody like a lot of us who, lends ourselves to like anxiety or just fear or overwhelming thoughts, I have realized that my physical environment has to stay pretty clear and uncluttered. And the second that it goes cluttering, sometimes I have to go hide the clutter until I'm ready to confront the clutter. And I have noticed that like I have to wake up on like a Saturday or Sunday and go, today's my decluttering day. I can do this. And I have to work myself up to it.
Yeah. Or sometimes you're just inspired. Ride the inspiration wave, right? So
exactly.
If you feel that fire under your butt, just go.
Go for it.
Don't even think about it. Yeah.
Exactly. Exactly. Justina's also dealing with a lot of fear. Just constantly fearing that she'll never conceive. And she's trying to train herself to prepare for a positive outcome and not focus so much on the fear. So thank you for acknowledging that. Justina, I deal with a lot of fear in my life and it throws me into action, but I recognize that I'm taking action on top of fear, so maybe the fear could be a positive trigger to do something good for herself.
Absolutely. That is kind of a lot of times, and that's why we say consistency. Do this every day, maintain. This could be preventative, but a lot of times we don't do things until we're really up against the wall. We're ready to fall off the cliff. And so, yes, fear can kick you into, okay, I have no other choice. I have to take care of myself, right? Yeah. It's like when you know you need to go see the doctor because you've just waited too long and you feel, I'm too sick now. I got to go to the doctor. Right. So it's that same type of feeling. Fear can be that. It's just that now we're no longer allowing it to do what it's been doing, that negativity. I'm actually going to confront this. That's what it is. It's confronting the fear. And however long it takes you is how long it takes you. And I think we are so hard on ourselves. We don't just do what feels good. We fear that something else might happen if we don't do this or if we do this wrong. There's just no right or wrong way to do anything. This is just an experience.
Right. I love that so much. I do recall in the beginning of this year when I got the Peloton for myself for Christmas. That was my Christmas present. I thought, thank goodness I did that before the pandemic hit, okay? Right. And I was really rigorous about it for the first few months, even like the first 6 months. And then there was like a shift. I don't know what happened during the pandemic. I sort of fell off the wagon. Mm-hmm. And then for like 2 or 3 months I didn't do it, and I was almost paralyzed by fear. And it was creeping into my leadership in the company, my ability to perform as a leader, my ability to like support my teammates as a leader, my parenting. And I just finally said, I heard myself say to my team or say to somebody, integrity needs to be bigger than my feelings. My word to myself needs to be bigger than my feelings. And I said, no matter how I'm feeling, I'm jumping on the damn bike. And I told it to my son. I was like, I am jumping on that bike no matter what. Mm-hmm. I don't care how I feel. If I feel like my legs, I'll go slow and steady if I have to. And I will say to those of you who are feeling fear, that 20 minutes of sweat, it might not be the highest amount of endorphins I can get because I didn't pump so hard. Right. But that has helped me maintain a much more even sort of homeostasis emotionally. Mm-hmm. Just by choosing to say, like, nope, I feel like crap this morning. I don't want to do this at all. But I said that my word is bigger than my emotion, so I'm doing it.
Yeah, you followed through on a commitment to yourself, which is the most important commitment you can make.
Right.
Yeah.
Point. Yeah. Yeah. And then pats on the back for that. Like if you guys are one of those people, like find those wins. I feel like this guy has some anxiety and depression too. He's crawling up my body right now because he wants a mama snuggle. He's so loud. He's so loud, but he was left too soon by his mama. So he's my needy guy. He spends a lot of time outside, but you know, he'll sort of force me to slow down. He'll you know, sit on me and like force me, okay, mama, I need a snuggle, which means you need to slow down and you need to take time to give me some love.
Yeah. And that's a great reminder, you know. It's like sometimes we just need to be like tugged and like, hey, you need to snap out of it for a minute. It's like we get consumed with our thoughts. So I said our minds are just insane. They're incredible. The things they can make us believe and think and do. And so it's like we do really need to check back in with us constantly.
Yes, exactly. Oh, he's a funny one because sometimes I also don't want to be touched. Yeah. I don't know if anybody else deals with that, with like their anxiety and their fear and stuff. It's like sometimes I'm like, I feel like my nerves are like hyperactive and I'm like, I don't, no animals are allowed to touch me. Please don't touch me.
Yeah. We're jumping out of our skin.
That's what it feels like. Yeah. I mean, we say that, but it does. It feels like the cells are like jittery. Yeah. Shelly's also saying, how do you build a support group? They've kept IVF quiet because of the fear of the loss, where you almost don't want the attention on the loss. You want everybody saying I'm sorry and sending the cards and the flowers and like the whole thing, right? So, but there's some great support groups through Resolve, Shelly. If you haven't had a chance to go to resolve.org, how do you guys do it locally or like in a virtual manner? Alison, do you normally practice just one-on-one, or do you sometimes, you know, have enough people to do like a virtual support group?
Yeah, so we actually provide a service where we do virtual support groups for agencies. Awesome. Yeah, for agents. So it's like depending on the agency we're working with, we can virtually do that right now, and that's what we've been doing. We've been doing it virtually. But typically I see clients one-on-one, you know, I see couples, and now it's been virtual, but we do provide a service where we do the virtual groups. We haven't had any, and it just depends on like agency to agency.
Got it. Okay. That's pretty awesome.
Yeah.
He sometimes will bite me when he wants even more attention, then that's not the way that he's allowed to get attention. As to saying, yes, just be kind to everyone. Totally. This is such a helpful conversation. I feel like I'm getting therapy. Are you guys feeling the same thing? I feel like I'm getting therapy from Alison right now. But, you know, even when I come on these, oh, hey, XOXO Providence, haven't seen you in a while. Caitlin, oh, good to see you again. And Sarah, love that. And she's giving me a little update. Love that. So she took 5 days of Provera, okay, in day 4 of cycle. So tomorrow she starts 5 days of Clomid. Okay, here's to praying for that. The cat is still trying to climb up me. He's just relentless. Hi, pretty face. All right, so it looks like we're out of questions right now. Is there anything, Alison, that hey, we're going to wrap up, bud, and we're just about out of time. He went second. Is there anything else that you want to leave us with in terms of resources or where folks should turn? They can certainly find you and your colleague on our app. You know, and yes, Shelly, if you DM me, I will get you the link to Resolve to find some online support groups that are just awesome. So just DM us right here at Fertility Answers, and I'll send you that link. It's resolve.org. But anything you want to link, you know, leave with us, like links to your website or to your support services. I know you're based in California. You can help everybody virtually in the state of California where you're licensed. Yep.
But we're licensed here. That's where I can help anybody, you know, virtually. And that's the great part is this is just kind of transcended us into like a new way of doing things. But I feel like in a sense for mental health, it's been so incredibly helpful. So if you are in California, and you are looking for, you know, support in general, it doesn't have to be solely fertility based at all. Sure. And we do offer a free 50-minute consultations. If you want to go on our website, it's cfstherapy.com. And you can kind of check us out and all that good stuff. But what I would say is obviously just the biggest thing is the self-care and to realize that you don't owe anything to anybody but yourself. And that the way you're feeling, to normalize that, and it's okay. You know, it's okay that we're not feeling great today, and it's okay that it may not be feeling great tomorrow. But, you know, this process is, you can be full of hope and optimism, but at the end of the day, really acknowledging where you're at and just kind of acknowledging those feelings and emotions and knowing that they're temporary and they're not going to last forever kind of moves you through just those understanding yourself and having that compassion.
I appreciate that so much. I did notice that somebody else had written privately about when we're faced, and we will at the ending, I just wanted to acknowledge her for letting me know that she had an ectopic and lost a tube. And so she dealt with two losses at the same time. So it's like two types of grief, losing a body part. And as somebody who lost both of her breasts, it is a really significant loss. It's significant. And
it feels like you're failing yourself in a sense. And so you have no control, you're grieving, but now you feel like I've even failed my own self. And so that's a very normal feeling, and it hurts.
Yeah. And I think that the thing with ectopics that are so difficult is the amount of times I've heard women say, what if that embryo had made it to my uterus, would it have given me my child? Mm. And so that double loss of what if that had been a healthy, normal embryo, right? And the tube failed me. It just couldn't get the embryo,
right,
into my uterus. And that idea of like losing the hope of a child and how close so many people with ectopics come to losing their own life. There's it's such a scary thing, and it's so always scary. An emergency. And I think that those are some of the things that, I get goosebumps even thinking about it. It's such a traumatic event. I think that the whole experience is such a traumatic event. I'm about to cry right now thinking even about her. And the amount of women and couples that we have in our Fertility Answers community who have gone through that is so unfortunately significant. It's a high volume of people. I wish we had better detection of that.
Right, exactly. It's like these are things that are out of our control, and that's the hardest part, is that I can't do anything about it. So I'm just supposed to lay down and take it. I don't know. This is kind of where we feel defeated, and I think it's important to acknowledge those things before we can move forward. Mm-hmm. And
I love that. So I think that our parting theme is going to be, you have permission to feel whatever it is you're feeling, the full spectrum of emotions, because the human experience is a spectrum of emotions.
It is.
And we love our Fertility Answers community so much. We're sending you so much love and support. And as always, you guys can find us on the Fertility Answers app, both iOS and Android. Download it, register, ask questions, because even though Alison is in California and unable to be your therapist individually, if you're in Southeast Asia, she can answer your questions on the app. And just like this dialogue today, she can answer your questions, ask your question, pick that the psychology category, and it'll get routed in the proper way. Alison, thank you for giving us so much time. I just feel warm and fuzzy right now. I feel great, and I think it's like a wonderful way to transition into going to be a mom now. And you're welcome, Red Cruz, for being there for you. It's our ultimate honor, in life.